Good morning, IMRC, respected judges, guests, and all friends. My name is Piriyakorn Wesakawee, a fourth-year medical school from King Mongkut Institute of Technology, Ladkrabang. Today, I'm going to present revolutionizing peer identification by using deep convolutional neural network based on widely used essential household remedy drugs. We will go all through all these contents today. Medication errors account for a large proportion of all medical errors, especially drug-to-drug interactions. According to the research, factors contributing to these errors include polypharmacy, prescribing cascade, and poor medication constellation. Therefore, pill identification plays a critical role in healthcare. However, these interactions are complex and require human specialists, so traditional methods often fall short due to the increasing variety of the medications. Additionally, this is more complicated by patient habits of discharging the medication containers and prescribing cascade, which exacerbate the risk of drug-to-drug interactions, as well as no labeling medication in some clinics or pharmacy. Nowadays, many research studies have introduced the AI-based pill identification system as it offers high performance and encourage more patient safety. However, most research is mainly based on the foreign country, not really in Thai setting. So we try to work more on the Thai setting and start preliminary study with the household remedy drugs. In this study, we aim to develop a deep convolutional neural network-based algorithm for accurate pill identification focused on the 10 commonly household remedy drugs as a first step before further study. The sample were including only household remedy drugs in solid tablet or capsule form. Any pills that broken, cracked, or incomplete were eliminated. To collecting the data, they will capture using a mobile phone camera under the control light, maintain a fixed distance of 20 centimeters from camera to pills with a top-down perspective. Ultimately, we collect 1,250 images for 10 drugs, with an 80% for training and 20% for testing. After data collection, all images will undergo the computerized augmentation process as it helps enhance the model performance by increasing the data diversity, reducing the overfitting, and improving the generalizability. In this study, the rotation, contrast, and blur were applied. The YOLO models were mainly utilized within the in-house Core program for algorithm training due to their efficiency, accuracy, and unified framework for object detection. Four series of different experiments were conducted to identify the best model for pure identification, and we'll explore the investigation of each experiment one by one. For this one, this is the first experiment. We investigate the lighting condition for implanting and plain pills. The result shows that even though the light bulb lighting worked better for the plain pill, the natural light performed best for implanting pill with the mean average precision of 99.3%. So we decide to use the natural light in the next experiment. The second evaluating for the base detection model, we compare the result between the various YOLO models, such as like V4 tiny, V5, V5 tiny, and so on. The result came out that the YOLO V5 Tiny was provided a base object detection model with the 99.7%. Then we want to explore which image scaling is the base for the model detection. As the table shows, the higher image resolution, the better performance of the model. And a 640 pixel image scale provides the optimal result for YOLO V5 Tiny with the mean average precision of 99.8%. Lastly, the experiment 4, which identified the classification model based on the crop image from object detection model. The best model among all is EfficientNet B0, which provides high accuracy at 99.6%. For this research, we utilized the various metrics to evaluate the model's performance, especially the 95% confidence interval, F1 score, and five-fold cross validation to assess the generalizability and robustness of the model. To elaborate, after complete the 5 round of model training, the classification model with the efficient net B0 also provides significant results at the 93.2% for mean accuracy and 91% for F1 score. In conclusion, the natural light base for the imprinting pills and the YOLO V5 Tiny with the 640 pixel resolution prove that it's highly effective for pill detection model, while efficient net B0 excel at classification model. Although our model demonstrates the significant performance, limitation includes a relatively small dataset and reduced generalizability to other drug types and environment. However, we plan to continue the research for further pill identification based on King Mongkut จ้าคุณทหาร Drug List Hospital. So, with the various drug type and environment and multiple pills, as well as to develop the drug-to-drug interaction detection algorithm, which will provide a significant benefit for medical practice and patient. As our approach provide an innovative pathway to medication safety management, it potentially reduces the prevalence of drug-to-drug interaction and adverse drug reaction in healthcare system. This research marks a significant first step in redefining the medication safety. It laid the foundation for proactive healthcare practice, promising to alleviated the global healthcare burden posed by drug-to-drug interactions and ultimately to improve patient outcome worldwide. So thank you for your attention, and I am happy to answer any question.
Congratulations, very interesting topics. Uh, I would like to know more clear about the selection of the medication because you said in the abstract how many images, but I don't know how many drug, and each drug have a varieties of the tablets. How can you design to collect the image data?
Okay, so this is our 10 household remedy drugs that uh, we select. And right now it's a preliminary study, so we select only one brand of each drug to taste the model first. But in the further study, we will try to work on the 50 in King Mongkut จ้าคุณทหาร Hospital drug list, which have the drug-to-drug interaction and will develop into the drug-to-drug interaction algorithm. For some household drug that have many generic, the brand, right? We will try to select the famous brand in Thailand from the on over-counter pharmacy to put it in our model ค่ะ so patient can use it with like the drug to drug interaction drugs or the over the counter brand that very famous in Thailand.
Um, I have like similar question to Dr. Ram because like for example paracetamol you have many brands in the market and I think you already answered that. My follow-up question, no, my another question is I think because the purpose of your research is to identify the drugs that have interaction, right? Would the program or would your algorithm flag if the patient have two drugs that have interaction? Because right now you only like try to identify which drug the patient have, right? But how do you flag that you shouldn't take this with that? I mean, for the med that have interaction.
So we'll develop another model to combine with the pill identification. This pill identification will detect what is the drug on the patient's hand first, and then another model will provide the information that if this drug appear and if this drug appear and if it have the interaction to each other, it will shows up and alert the patient ค่ะ so thank you ค่ะ